Hey you guys, and welcome back. Today is day 6 of being post-op from having surgery, having my tubes removed, and I am feeling a lot better, a lot better than the past few days. The swelling has significantly gone down, and so I'm starting to feel more like myself now that I'm able to kind of get up and get moving and whatnot. I was actually supposed to return back to work today. However, I decided to take the next week off just to kind of fully heal a little bit more mentally, physically, and just feel a lot better. I'm still not feeling 100% like okay, but I'm feeling a lot better than day 1, 2, 3, and 4, and 5. And so just, I do have an office job. I do have my own little office, and I do sit down for most of the time. However, I am up and walking back and forth from my printer to the courtroom to, wherever I need to be doing. And so I just decided to just stay home and just take it easy, because sitting on my butt all day for 7.5 hours and just being under stress for a lot of for those 7.5 hours was not going to be beneficial for me. I was going to feel drained and feeling a lot of discomfort. So I just decided to take the time off, just so that I can fully heal and come back stronger and really focus on my work when I do come back. So I decided to take the whole week off. Overall, like I said, I'm feeling amazing. I'm finally feeling like myself. I know these past few days were really rough for me. Mental state, however, I am still struggling a tad bit more. Not a bit more, but I am still struggling with it. I'm still feeling a little depressed, feeling sad, not because of my surgery, not because of what the decision that I made, but simply because I think it's mostly because the fact that I can't really do what I normally do. I'm not within my normal routine of, waking up at 5, working out, showering, and just going about my day without needing assistance from anybody. Mind you, I no longer need assistance anymore. However, if I'm sitting in an awkward position or I'm slouched too far back, I do need a little bit of assistance to kind of push me forward so that I don't use my tummy a lot. But overall, I'm able to kind of get up and move around on my own. The swelling has significantly gone down. I am still obviously a little swollen, and I notice that in the mornings I'm less swollen. However, in the evening I do tend to like flare up, and that's probably because I'm up and about, moving and whatnot. So, I mean, that I'm pretty sure that's normal stuff. But yeah, I feel a lot better than how I did in days 1 through 5. I feel more alive, that's for sure. Let's see. So just a little backstory of me. I know that I kind of wanted to share my story on day 1 with you guys. However, I didn't really get to because, your girl was in pain and had lots of things going on. However, I do want to let you guys know that I have 3 daughters. I have a 13-year-old, 11-year-old, and a soon-to-be 6-year-old. I don't have any son, no boys. My husband and I have known for quite some time, maybe roughly 3 to 4 years, that we no longer want any more children. We both come from very large families, and we've always known that we don't want a big family. 2, 3 kids was our max. And so we've known this for a very long time. And despite that we don't have a boy, I'm totally fine without having a son. He's totally fine without, he doesn't need a son is what he says. He has his girls, and his girls very much love him. They're daddy's girls, so they're constantly with him. So, I mean, it's not like we need a boy. We're totally fine with that. I was also, let's see, prior to getting my tubes tied, I had the IUD copper, the one that's in me for 10 years, the one that's non-hormonal. I've had that, and I've been struggling with it for the past 5-6 years. Before that, I was on, for birth control, I was on the patches. I had the arm implant one, and those all contain hormones, and those were like the worst days of my life. I cannot have additional hormones in my body. I was always depressed, feeling negative about myself. I just struggled very, very, very much. So then that's when I made the decision, you know what, I'm going to get the copper IUD. It's non-hormonal. However, it does have some severe side effects, which include heavy abdominal cramping and heavy bleeding. And I was fine with that because I just didn't, I cannot do the extra hormones. So I decided, you know what, I'd rather much have the heavy cramping and the heavy period if that means that I'm going to be a lot happier or in a better mental state than how I was with the hormonal birth control. So I had that in me for like roughly 6 years. And let me tell you, although I very much felt like myself and I enjoy not having the extra hormones, it was a pain in the butt having the heavy cramping and the heavy bleeding. So just FYI, the heavy cramping for me was roughly 2 weeks out of the month. So 1 week before my period and then 1 week during my period. So 2 weeks out of the month, I would suffer from abdominal cramping. Now, it wasn't a constant abdominal cramping, but it was a lot of cramping to the point where I was like, ugh, I felt yucky about myself. And the heavy bleeding lasted about 3 to 4 days, depending on, I don't know, it was just 3 to 4 days heavy bleeding. And so last year I was kind of, fed up with it. I told my husband, you know what? We both know we don't want any more children. Why am I suffering? Why do I need to be going through this? And I asked him if he wanted to get himself fixed. However, he did not want to. And I know that a lot of people would be like, well, it should be he should do it. It's such a minimal procedure for him and blah, 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 blah. But you know what? It's his body. It's his decision. And I'm no one to force him to do it. If he wants to do it, then he's going to do it. If he doesn't, then he's not going to do it. Is my type of thing. That's his body, his decision. And so given that it was my decision to get myself, get this surgery and whatnot, I figured it's only fair that I do it. I'm the one that brought it up. I'm the one that wants to stop suffering with the IUD and whatnot. So, I mean, I can't force them, right? And I'm totally fine with that. So yeah, that's kind of a little bit of the backstory. Let's see. So like I said, I went to my consultation last year, and I was really determined to get it done. But unfortunately, I got freaked out because the doctor kind of had explained to me what was going to happen. That I was going to be put under, that I was going to have a tube down my throat, that I was going to have my belly filled up with air, that there was going to be 3 incisions and whatnot. She freaked me out. And I left the office like, there's no way in hell I'm going to go through this. There is no way in hell I'm going to go through this. Even though I knew that I wanted to do it, I just got freaked out with how, she had explained the procedure to me. And so I got freaked out. So long story short, I went back this year and I was like, you know what? I'm done with the IUD. I'm done going through the cramps. I'm done with the heavy bleeding. I'm done with it. There's no reason why I need to be going through this. I don't want any more children. We don't want any more children. And so I finally made the decision a few weeks ago to go back again and get my consultation and schedule my surgery. And now here I am, 6 days post-op. And yeah, that's pretty much it. Do I regret it? I have no regrets whatsoever. I did have my moments of regrets, not because I changed my mind and I wanted to have more children, but simply because, it's surgery. You have your downs and your ups during the healing process. And so I was struggling a little bit more mentally than physically. So those were my moments of regrets. But now that I'm feeling better each day, I'm like, okay, this was the best decision that I could have made. Now, do I know what the future holds for me? Do I know if it's going to affect my body in some sort of way in the future? I don't know. Everybody is different, and everybody heals differently. So I don't know what the future holds, but I don't regret my procedure whatsoever. So in this short, well, it's not really short video anymore because we're in 10 minutes, but in this video, I wanted to talk to you guys about the care instructions after leaving the hospital. When I was actually looking for videos just to get more information about getting my tubes removed, there wasn't really any, like nothing. I mean, I saw a lot of tubal ligation videos, but nothing really about getting your tubes removed. And so one thing that I do want to say is that tubal ligation, you get your tubes tied, basically. So my doctor does not do that. My doctor goes in there and actually removes the whole fallopian tube because it decreases the chances of getting ovarian cancer, and it also significantly, like, there's no possible way that you can possibly get pregnant after getting your tubes removed. And so with getting your tubes tied, there's a very slim chance, obviously, right, of getting an ectopic pregnancy or possibly getting pregnant. And so I knew that I don't want to have any more children, so let's go for the best route where I can't possibly get pregnant. So that's why, plus she doesn't do the tubal ligation, she just removes the fallopian tubes, for the main reason that it decreases significantly the chances of ovarian cancer. So that's why I went with what I went with. So like I said, there wasn't any YouTube videos out there kind of informing me of what to expect or how people were feeling or care instructions after like leaving the hospital. So there just wasn't any information out there. And so I thought that I'd make this video to kind of give you guys a heads up of what to kind of expect after surgery. So if you guys have not seen my other videos, like day 1, 2, 3, 4, and 5, go ahead and watch those. You'll get real like footage of how I'm feeling. And just, I mean, like I said, everybody's different. This is my experience. But you'll be able to kind of get a glimpse of how I'm feeling mentally, physically, and kind of what's going on with me, to kind of get an idea of what could possibly happen to you. I don't know. But yeah, so we're going to go over the care instructions after leaving the hospital. Of course, this was given to me by my doctor. So this is information from my doctor, not just specifically from me. So, of course, you're going to be put asleep. You're going to be put under anesthesia. And so the first question is, how will I keep myself safe during daily activities? The medication which were used for your sedation or anesthesia will be acting in your body for at least 24 hours. Therefore, during this time, we recommend you not to drive a car or operate machinery. Do not consume alcohol, tranquilizers, sleeping pills, non-prescribed medications. Do not make any important decisions or sign any legally binding papers. Have a responsible adult stay with you for 24 hours. So activity limitations. Resume normal activity gradually as tolerated. Basically, just take it slow. No strenuous activity, heavy lifting until cleared by your surgeon. You may shower after 24 hours, which is awesome. No baths, hot tubs, or pools. Activity limitations. No baths, swimming, hot tubs for 4 weeks. Shower only, no heavy lifting for 4 weeks. So it is very important that you have somebody with you for at least the first 24 hours, because you're going to be in and out. You're going to be super sleepy. You're going to be exhausted, and you just need somebody to kind of be there and comfort you, because when you're under anesthesia, sometimes a lot of the people will wake up feeling emotional. I know I did. I woke up feeling emotional, and once again, not because of the decision I made, but just because your body is just naturally, you did something big. So you're confused, you wake up froggy, you just want to be hugged and cared for. And so just have somebody with you for at least the first 24 hours. How will I manage my diet and nutrition? Post-procedure diet. Resume your normal diet. Avoid spicy or greasy foods. So this is very important, and I learned this the hard way. the first night of my surgery, I ended up eating greasy food, which ended up getting me really bloated, more swollen than what I initially was. There's a lot of salt. It made me feel so uncomfortable. So I recommend you guys resume your normal diet, but don't overdo it with like greasy food or salty food, because that's gonna all get retained in you. So yeah, I know that the next few days I ended up eating a lot healthier, and that I definitely saw some positives in that. I felt better in general. Make sure that you also drink tons and tons and tons of water. The more water you drink, the better. That'll help flush out your system, help flush out the anesthesia, help flush out all that crap that's in your body, and help reduce the swelling. It'll help the healing process. So make sure you guys are drinking plenty of water. Also, if you're taking the medication, the ibuprofen, the oxycodone, you can also get constipated severely. And so make sure you guys have some stool softeners on hand. You can ask your doctor to give you a prescription, and it'll help, because with all that medication, the anesthesia, you do get constipated. So make sure you guys have some stool softeners in your hand, and make sure you drink plenty of water. I cannot that's a big thing. Drink lots of water. How do I care for my incisions, wounds, and or drains? So depending on your doctor, they may use surgical glue. I think I've seen staples. They may use staples. They may use what's the other thing called? My mind just went blank. Oh my god, my mind just went totally blank. Wow. Okay, they may use surgical glue, staples, or oh my gosh, if the word comes to my mind, I'm pretty sure you guys know what I'm talking about. Stitches. There you go. They may use stitches that just dissolve. So that's very dependent on your doctor. My doctor used surgical glue. I didn't ask why she preferred using the surgical glue, but that's what I got. I got surgical glue. And so my wound care was just basically keep it dry. I could shower, make sure that I wasn't scrubbing on it so that surgical glue doesn't come off. The surgical glue should be coming off within a few days by itself, maybe a week or so. After a week or so, it'll just kind of fall off by itself. And just making sure that I pat dry it, not rub it off, was the main thing. And so, let's see. What can I expect after the procedure? After the procedure, it is common to have pain in your abdomen, some light vaginal bleeding, spotting for a few days, tiredness. Your recovery time will vary depending on which method your surgeon used for your surgery. So that's very dependent on what surgery method they used. I will say that I did have pain in my abdomen. I will say that I did have some slight vaginal bleeding, spotting, and that only lasted for like a day or two. Very light, only when I wiped. And I was feeling very tired. Until this day, I still feel tired. Like I've been taking naps like no other. I've been feeling very tired, and that's all normal. Let's see. Activity. Rest as told by your healthcare provider. Avoid sitting for a long time without moving. Get up to take short walks every 1 to 2 hours. This is important to improve blood flow and breathing. Ask for help if you feel weak or unsteady. Return to your normal activities as told by your healthcare provider. As your healthcare provider, what activities are safe for you? Do not drive until your healthcare provider says so. Do not lift anything that is heavier than 10 pounds or the limit that you are told until your healthcare provider says that it's safe. This may be 2 to 6 weeks depending on your surgery. Until your healthcare provider approves, do not douche, do not use tampons, and do not have sex. So they said anywhere between 2 to 6 weeks. However, when I did talk to my doctor, she kind of expressed, take it easy, and that I, more than anyone, know my body. And if I feel that I can start resuming things more quickly, that's perfectly fine. Just take it very easy and listen to your body. So listen to your body. Your body will tell you if you're doing too much. And trust me, I've pushed myself a little bit and my body has told me, stop it, Maria, stop it. And I ended up feeling not too well. So one of the important things is making sure that you're walking around every 1 to 2 hours. I will say that there were times where I would, just lay down for like 5-6 hours, and that was not good. My feet would swell up a lot more. My feet were achy. My body was achy. I was so out of breath. So getting up and just walking roughly for 10 minutes at a time is something that needs to be done. Yeah. So let's see. It's another question. Oh, general instructions. Wear compression stockings as told by your healthcare provider. These stockings can help prevent blood clots and reduce swelling in your legs. I did not do that. So I suffered from severe swelling in my legs. I'll insert a clip to show you how swollen my feet were. Do not use any products that contain nicotine or tobacco, such as cigarettes, e-cigarettes, chewing tobacco, and blah, 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 which I don't smoke. Do not take a bath, swim, or use hot tubs until your healthcare provider approves. Keep all follow-up visits as told by your healthcare provider. Contact a healthcare provider if you have pain when you urinate, redness, swelling, or pain around an incision, fluid or blood coming from the incision, pus or a bad smell coming from the incision, an incision that feels warm to the touch, a fever, abdominal pain that gets worse or does not get better with medicine, an incision that starts to break open, a rash, lightheadedness, nausea, and vomiting. Thankfully, I haven't had any of those side effects. Well, I wouldn't say side effects. Thankfully, I haven't had any of those things happen to me so far. So, yeah. Get help right away if you have pain in your chest or leg, develop shortness of breath, faint, have increased or heavy vaginal bleeding, such as soaking a pad in an hour. The only thing that I did develop was shortness of breath, but I think it wasn't severe, like to where I felt like I was going to pass out. It was just more like, type of thing, which I assume was pretty normal, especially given after any time you have surgery and you're put under, you develop shortness of breath. It's normal. So in general, after the procedure, it is common to feel tired, have some pain in your abdomen, and have some light vaginal bleeding for a few days. Follow instructions from your healthcare provider about how to take care of your incisions. Return to your normal activities as told by your healthcare provider. Ask your healthcare provider what activities are safe for you. So that's very dependent on what you do on a typical day. Do not douche, use tampons, or have sex until your healthcare provider approves. Keep all follow-up visits as told by your healthcare provider. This information is not intended to replace advice given to you by your healthcare provider. Make sure you discuss any questions you have with your healthcare provider. So that's just kind of a rundown of what to kind of expect after the procedure. I hope this was informative for you guys. If you guys have any questions, feel free to leave them in the comments below and I will try to answer them. Like and subscribe if you're just watching this is your first time watching this video. Go back to my channel and check out days 1 through 5. They are very short compared to this video. It'll show some pictures, some footage of my incisions if you're curious. I will also insert a pic of my incisions for today, day 6. and a picture of my feet. So yeah, if you guys have any questions, like I said, leave them down in the comments below. Please like and subscribe, help me out. Other than that, I hope you guys have an amazing day. Thanks for watching.